Okay, knock, knock, knock. Wash my hands. Hello, my name is Amy. I'm a Harper nurse. Can I have your name and your date of birth?
John Smith.
Date of birth?
2/14/97.
Okay, alright. Today we're going to be doing a respiratory assessment. Is that okay?
Sure.
Alright, great. I have a couple questions for you. Are you a smoker?
No.
Okay, and do you have any respiratory issues as far as like emphysema,
Not that I know
asthma? What?
Not that I know of.
Bronchitis? Okay, alright, great. Well, first I'm going to start off with a general inspection. So I'm going to look at the front, I'm looking at the sides and the back, looking for any sores or any discolorations. I want to see, looking at the color of the skin, any blueness, any paler, which I'm not seeing. Also, his respiratory rate is within normal range. His breathing pattern is normal, and he's sitting up straight. He's not having any kind of trouble breathing. The symmetry to his chest is normal. And I also look at the anterior, posterior to the transverse ratio, and that looks normal to me. All right, next, I also check for any retractions or bulging of the interspaces, which I don't see any of that. Next, I move on to palpation. So I'm going to touch your chest, and I'm feeling for any kind of tenderness. Let me know if you feel any pain. Touch on the sides. And then I'm going to hold your arm up, and I'm going to feel on the sides here. Any tenderness, any lumps. So that's good. And then I'm going to go on this side. And if you could lift your arm, I'm just going to feel on the sides here. Alright, and then I'm going to check in the back as well for any lumps, tenderness, any pain. That's good. And then I'm going to have you stand up and turn around to the side. And I'm going to put my arms here. And if you could breathe in. And I see normal rising of my hands, so that's normal. Okay, you can sit back down. All right, next I'm going to start with the auscultation of the lungs. Okay. All right, and as I go in, I'm going to have you take a deep breath in through the mouth and out. So I'm going to start with the tracheal area. Deep breath in and out. And then check the other side. Deep breath in and out. Okay, let's start here. Deep breath in. And if you could stand up. On the right side, I'm going to listen to the 3 lobes. So I have the right upper lobe, right middle lobe, and the right lower lobe. Okay, and then on the left side, I have my 2 lobes, so breathe in. Are you feeling okay? Any shortness of breath? Any trouble breathing, right?
Nope.
Okay, and then I'm going to listen to the back.
You can stand in or sit?
You can sit down. And then in the back, I started all the way at the top. This side. All right. In the tracheal area, I hear bronchial sounds. Here in the middle chest and in the middle of the back, I hear bronchiovesicular sounds. And then along the periphery area in the front and in the periphery of the back, I hear vesicular sounds. And that completes my assessment of respiratory.